Dr. Owenbrink again. We're going to review the neurotransmitters involved in addiction, the drugs that mimic them, and the neurologic and behavioral effects of these neurotransmitters on the brain and on our behavior. Why are drugs addictive? The brain makes its own drugs. If you look at this table, there are three columns. The left column would be the normal neurotransmitters in the brain. The middle column would be the drugs that mimic those neurotransmitters. And the far right column would be the receptors located in the brain, where they're located. So on the left, you see that endorphins and enkephalins are produced by the brain. They're mimicked by morphine, heroin, the opiates. Receptors are all over the brain. Anandamide is a neurotransmitter that's mimicked by the cannabis, THC, marijuana family. Most of those receptors are in the superior brainstem. Acetylcholine involves the nicotine receptors throughout the entire brain. Dopamine, mimicked by cocaine, amphetamine, methamphetamine. Receptors are mainly in the mesocortical and mesolimbic area. Gamma hydroxybutyrate, GHB, the drug that mimics that would be alcohol and the benzodiazepines, alcohol in tablet form, found throughout the modern and primitive brain areas. Serotonin and glutamate are mimicked by hallucinogens. They're located mainly in the parahippocampus and the cerebral cortex. Drugs hijack the reward system of the brain. Drugs of abuse mimic the brain's own neurotransmitters. They stimulate the brain's receptors in the reward system, causing dopamine release, leading to the artificial high. Occasional use starts the impulsive cycle. It feels good, let's do it again, teaching the brain to anticipate reward. This leads to the compulsive cycle. Repeated exposure leads to craving, to brain adaptation, neuroplasticity, and repeated use. Neuroplasticity is the physiologic anatomic term of more receptors forming because there's so much drug there, the brain makes more receptors for that excess amount of drug. Neurobehavior change is the behavioral mental health term for what goes on with neuroplasticity. And again, this is basically an increased number of receptors forming for any given drug or neurotransmitter in any specific area of the brain when there's more drug than can occupy the receptors. Those receptors are located all over the brain. There are several different main receptor types. Delta is involved in pain relief. It's an antidepressant, can cause seizures, physical dependence, and decreases breathing. Kappa is involved in pain relief, has anti-seizure effect, can cause depression, disassociation, hallucination, urine flow, dysphoria, making you feel bad, small pupils, has neuroprotective effects, causes sedation, and can cause stress in excess amounts. The mu1 is involved in pain relief and physical dependence. Mu2, respiratory depression, narrowed pupils, feeling good, constipation, physical dependence. The nociception receptor causes anxiety, appetite, depression, development of tolerance to the mu effects. Zeta is involved in embryonic development and regulation of cancer cell proliferation. Cannabinoid system. And the neocortex, the higher cognitive functions of thought, integration of sensory and information. In the cerebellum, it's involved with motor control and coordination. This is where the largest number of endocannabinoid receptors are located in the brain. There are also receptors in the hypothalamus, where it's involved with regulation of appetite, sleep cycle, sexual behavior, reaction to stress, and hormonal levels, the neuroendocrine link. The basal ganglia THC receptors are involved in motor control and coordination. In the ventral striatum, they project into the feelings of reward in the hippocampus and the amygdala. The hippocampus, memory, learning of facts, sequences, and places. The amygdala, anxiety, emotion, fear, paranoia. Excuse me, brainstem and spinal cord, the vomiting reflex and sensation of pain. Acetylcholine has two major types of receptors, nicotinic for nicotine and muscarinic. These receptors are located throughout the brain: the thalamus, deep layers of the cerebral cortex, ventral tegmental area, medial habenula, substantia nigra, and pars compacta. There's an A3 receptor strongly expressed in the locus coeruleus, habenula, and intrapedicular nucleus. Peripheral tissues also have strong concentrations of the A3 receptor in the autonomic and sensory ganglia, and the A4 receptor is quite prevalent in the trigeminal ganglion, which involves the face. Dopamine and norepinephrine system. The mesolimbic system involved with ADD, ADHD, addiction, schizophrenia. The mesocortical system, ADD, ADHD, addiction, schizophrenia. Nigrostriatal area, addiction, chorea, a dancing-like movement, and Parkinson's, another movement disorder disease. And finally, the tuberoinfundibular area of the brain, which is involved in hyperprolactinemia, which often causes nipple discharge. Gamma hydroxybutyrate, the GABA system, has a neuroinhibitory functions. The main areas would be the frontal cortex, memory, emotions, thoughts, cerebral cortex, thought coordination, cerebellum coordination, nucleus accumbens, the reward addiction centers working with dopamine and serotonin, the amygdala involved with emotions, survival instinct, and memory, and the hippocampus.